Hello, Vagina. Cheers to being a woman, but womanhood, it's a jungle down there. Get ready to be real, raw, and totally uncensored as we explore the depths of health, sex, motherhood, and relationships. Strap in for those topics that make you cringe, make you blush, and make you want to hide your face. Welcome to the Hello Vagina podcast. Hello and welcome back to the Hello Vagina podcast. So with me today, I have Felicity Ward. She's a wife, an INC Miss Bikini Pro, and a cosmetic nurse injector. Welcome to the show, Felicity.
Thank you so much for having me, Tara.
No problem. So a cosmetic nurse injector, can you tell me, how do you get started in something like that?
So I am a registered nurse. You need to have a medical qualification to do injectables, so either to be a doctor or a registered nurse. I obviously went to uni, I did my undergrad, I did lots of hospital work first, and then I got into the cosmetic industry. Started in a place where I was doing skin and injectables, and the rest is history, basically.
Amazing. So you obviously need to be then qualified to do injectables. And what kind of treatments fall under that category?
So with cosmetic injectables, the most common ones are anti wrinkle injections, dermal fillers, fat dissolving, microfillers. They're the main ones that you'll find when you go to any clinic. Then there's also places who will offer you medical skin treatments as well, and obviously more advanced, like sort of mini surgical procedures as well. But yeah, mostly those injectables, the anti-wrinkle and the dermal fillers, are the most popular ones.
Yeah, definitely. So staying on that topic of injectable fillers, anti-wrinkle injections, what are the common myths that you see? I think there's a lot of stereotypes and myths in this space. You know, you've got to be, only the fake plastic girls get it. Or I think people's common response is like, you don't need that. It's like, well, I don't need it, but I'd like it. So what are some of the main stereotypes or myths that you experience or have heard?
Oh my gosh, so many. And this is the part that I really want to get out to women, that it's okay to do it, and that most people are doing it. They just might not be talking about it. Yeah. We are seeing a big shift, but there is still all those common ones of it's only for much older people, for people who are vain or, really, self-centered, that it will look, as you said, fake, weird, plastic, that everyone will notice. And the main one is people worried about that they're going to be judged for doing it. Yeah. So they're probably the main ones that I hear. As I mentioned, there is this sort of shift that's happening, but still happening quite slowly.
Yeah, definitely. I think there's a lot of judgment that I think there's the people that take it to an extreme, and they're the ones that we sort of see in the media because they're the ones that come out and say, like, I've had it done. Kylie Jenner and the Kardashians, I guess, are a really good one for cosmetic, coming out with the cosmetic procedures that they have done, watching the evolution of Kylie Jenner's lips.
Yes.
Everybody sort of thinks that you're going to go duck lips if you get your lips done. And I think that they don't realize that that's a choice. Like, you have to keep choosing to put more and more in. You don't necessarily have to get that as your first go. And I'd imagine for a lot of women, you can't actually get that first go. Like, that's probably a lot of treatment in one
yes
to actually get that kind of volume. It's a build up to get to that kind of size.
Yeah. And I think the most important thing you said there was it's a choice to go to that point. And obviously that's the thing that is put in front of us. We don't generally see these sort of very natural looking people in front of us, social media and things like that, being really open about their injectables. It is more like Kardashians and people like that. But they've chosen to take it to that level. And I say each to their own. 99% of my clients want a very subtle, very natural result. And that's what you're going to get. you know, unless you come in and you say, I want this and I want these big lips and things, and you're not going to get it first go. It's going to be this huge journey to get to that point. And also a lot of people don't actually have the structural features to even achieve that. You know, if someone comes in with really small lips, after their first session, their lips are going to look very similar, just a little bit fuller. They're not going to walk out with Kardashian lips after 1 mil. That's for sure.
Yeah, no, I've definitely had this experience. I've had my lips done once, and admittingly, we did want bigger lips. My younger sister and I went in together, and we did I guess there's different strengths of how much volume you're getting from it. So I think we did a mil both times, but we had the sort of subtle one.
Yeah.
And I think that was partially a ploy because the lady knew we wanted bigger. So 2 weeks later, we were back in spending another $500 for the bigger ones. Like actually, because we didn't feel like there was that much of a change. And I think that's the thing. It doesn't just blow up your lips and you've got these giant fish lips straight away. Like you actually you have to make that decision, and your nurse has to actually put that in for you.
Yes, exactly. And that's pretty much what happens to every single person every time they do it. They sort of have this sort of almost freak out, and, you know, as you know, there's some swelling and there can be some bruising. 4 to 6 weeks later, they're messaging you saying, can I have some more? And they were the ones who were usually, you know, absolutely terrified about it being, you know, too much or anything like that.
Yeah, reminds me of breast implant booby greed that I'd read a lot about girls that had implants, and so many of them were like, I wish I'd gone bigger once they went down. You know, everybody wants to go too much to start with, but as soon as they have them and they've settled, they're like, oh my gosh, I wish I'd gone bigger. Like something that I'd read so much on the forums before I had mine done. And I think that's, you touched on a really good point there too, in terms of the people that, there's probably a lot of people that are actually having these treatments and you don't realize, you know, you might think that they're just really good at their skin routine and looking after their skin, and not actually realizing that part of their routine is to go in for some regular Botox so that they're keeping those frown lines away and keeping those crow's feet at bay.
Yes, exactly. And I think that's, you know, another thing that comes into those myths and stereotypes is that a lot of people think injectors just fill up your lips. That's, you know, we just give people big lips. But some of the most satisfying treatments I have done for clients have actually been those really small things that no one else will even notice, but it's something that may have been bothering them for a while. Like, say they've had a frown line and people at work maybe say they look sort of angry or really intense all the time, and simply softening that can make such a big difference. For people, facial asymmetry, so they might have, you know, one cheek sits higher or one side of their lip sits higher, and actually working to correct that can be just such a big thing for them. Or, you know, someone who doesn't like their side profile, you give them a chin. No one notices that they've had their chin done, but all of a sudden they've got this new confidence because they like taking photos with their side profile now. Like, just all those little things, but they're not things that people would look at them and go, oh, you've had cosmetic injectables.
Yeah, definitely. And I think that touches on the really good point that it's not necessarily about the vanity. I know a friend that gets them in the jawline because she's a clencher that gives like quite severe jaw pain, and Botox can stop you from clenching.
Yes, that one is like life-changing for some people who grind their teeth, they clench, they get headaches from it. They do it. Again, no one would know that they've had Botox, but for them, they're suddenly waking up without headaches. That's life-changing.
Yeah, definitely. That definitely touches on the points where it is very different. So what are some, when women are considering getting these treatments done, what are some things to look for when choosing a nurse in a clinic?
So obviously you want to make sure that you are going to see a registered nurse or a doctor and someone who is trained in cosmetic injectables. We are lucky in Australia, we do have very strict rules and regulations, unlike places overseas, that you're not going to find, you know, people doing dodgy things here. Well, I hope so.
Some home warehouse grade silicone injection.
Yes. Yes, exactly. And we've obviously got very strict rules around the products as well. You want to be going, you know, check out the clinic, check out their Instagram, their website, or the injector's Instagram or website. Have a look at their work, because obviously there's so many injectors. Everyone has you know, a slightly different style to the way they do things and different things that they're good at. And each person who's going to look for these types of things obviously has a different look that they want as well. So, you know, a lot of people will sort of say, oh, you know, I had a bad experience with someone or something like that. But it might just be that you need to almost get the right fit for you. And that's why it's really good to go and have a consultation, talk to the injector, get to know them, have a look at their work, really listen to what they can do for you, and then make your decision. You know, does that feel like the right fit for you as well?
Mm-hmm. Yeah, no, I think that's definitely all very good advice on that. Because I think some people's concern too is like, are they going to over-prescribe what I need? And maybe you can touch on, so in terms of units, so if anybody hasn't had fillers before, especially sort of your anti-wrinkle, it's worked out in units is a measurement. And some of them can be quite a lot. You know, they're like, oh, we're going to do 40 units. And that sounds like a lot. But obviously it's not actually as huge of a measurement as you think it is. Can you touch on that a little bit?
Yes, and this is one where it can get quite confusing because of the regulations, we can't actually talk about what the products are called openly. Obviously, when a client comes into the clinic, we can talk about exactly what the products are, but that's why we have that broad word of anti-wrinkle injections.
Yep.
Which are the muscle relaxants and then the dermal fillers. With the anti-wrinkle, you're correct, that's dosed in units, and a lot of people will either sort of see it advertised, you know, 3 areas or 40 units, like you said, those sorts of things.
Yep.
And they can get sort of quite caught up in, you know, how many units they're having. And that's a discussion that I always have with my clients and letting them know what they are having. But what people need to realise is between the different products that can be used, the doses do vary. And so there is this, you know, people will sometimes come in and say, oh, my friend had 40 units, so I need 40 units. But it can be obviously totally different in terms of what everyone needs. Depends which product was used, depends which area was treated. So that's, again, where a consultation is really important, and knowing what product you're getting, how many units or how many areas that you are getting, and not getting too caught up on that, because your practitioner is the one at the end of the day who knows how much you need. We do have obviously therapeutic dose ranges, and then some people will obviously need above that if they've got really strong muscles or really deep lines, things like that. But definitely just, you know, trust your practitioner that they are going to dose you correctly, and also be really open. You know, if it's your first time, let your doctor or your nurse know that you do want to start with maybe a lighter dose. We can always add to it, you know, as you feel comfortable with it as well. Let them know that you don't want a kind of really heavy or frozen feeling as well. That's really important to have that discussion.
Yeah, definitely. So when should women start considering having these treatments done?
So my advice is always when you feel ready, but I do like to educate clients that starting early is actually a really good thing, even though there is this misconception that, you know, people are too young, or, you know, it's silly if they start younger. It's better for you long term and as you age, because this is where we're thinking about age prevention, and your injector is going to love you for it as well. So I have clients in their early 20s who have frown and forehead lines. Then I've got clients in their 40s who don't have lines. So it does come down to your face, your genetics, how you've looked after yourself, all those sorts of things. But the best way to think about this is age prevention. So in particular, if we start talking about anti-wrinkle injections first, because that's often what people will come in when they are thinking about age prevention, is my advice is when you start to see like frown and forehead lines just at rest, like the little ones that settle into your makeup by the end of the day, that is a really good time to start thinking about treating with anti-wrinkle, because we want to prevent those lines from getting deeper. Because once they're really deep and they're really set in, and someone comes to me with really, really deep lines and they want a totally smooth forehead, I'm unfortunately the bearer of bad news that I can't get them that I can soften it, but we can't make it perfectly smooth. But if you come to me when you've just started to notice that, you will be able to smooth out those lines, and you'll be able to basically prevent, if you keep up your treatments, basically prevent having lines later on in life.
Interesting.
Yeah. Then when we come to dermal fillers, that one is obviously, again, a choice for people. But when you want to start considering these as an age prevention thing is when you start to see those slight signs of structure and volume loss in the face. The dermal fillers are able to basically replace that and also enhance features in the face. So most people, they think about lip filler and just, as we were talking about before, people having big lips. But we use dermal fillers a lot through people's faces when they start to notice, flattening through the cheeks, heaviness under the eyes, feeling heavier in the lower face. And they're all signs that face is having some structure and volume loss. So we can actually basically support the face and lift up the face and actually really slow down that process of that loss. And again, for some of my clients, that will happen in their early 20s. Some of that clients, it won't happen until their 30s or 40s or even longer. So again, it is very individual, and it is a good thing to really get your face assessed if you are noticing those things. And again, the earlier you start, you're going to need less product than if you come in later on in life as well. So that's a good thing. Yeah.
I must say, that's really disappointing for me to hear, only because I have a really serious frown line. So frowning is my resting face. I frown when I'm concentrating. I frown for no reason at all. And I noticed that really deep frown line right in between my eyebrows. And I've probably had maybe half a dozen goes of Botox over the last, I think I had my first one when I would have been maybe 27 and now I'm 33. And nobody's actually said to me like, oh, we're never going to be able to completely smooth that out. So it's a little disappointing to know that I would say it's definitely well set in and has been for quite a significant amount of time, because it's a permanent thing I do. Like, I can feel myself doing it when I'm working. It's just constantly.
Just constant. Yeah, I've probably just ruined your day, haven't I?
Brown, yeah, no. Oh, well, I'm better. I just have to tell my husband now. I'm like, no, sorry. Felicity said I must start now if I want any chance.
Got to keep it up.
Like crater in my forehead for the rest of my life. But then, they're definitely really good points there in terms of that preventative, because I think a lot of people, and like especially for me, so my ex-partner and my current husband have both said to me that typical line of, you don't need it or you're not old enough, and trying to explain to people like it's a preventative. If you your crow's feet, for example, by freezing you being able to squint, that stops the line, because a lot of these lines too are expression lines. They're from doing an expression over and over again, and that's why some people have them in some places that other people don't have them, because it's not an expression that they do. So it's definitely something to sort of point out to people that it's not a vanity thing, and it is a preventative thing. And for all women, I think, we don't like these lines as you start to get older and you really start to notice them more and more, and you're like, oh, take that selfie and you're trying to change the angle of your face and you're like, nope, they're still there. You're like, okay, hello lines, welcome, getting older now. But
you got to keep up that selfie game.
Yeah, that's right. I want to be able to I don't want to have to get the app out and smooth my face over. It's just, so it's definitely something that, I think for women, it's really important for us to sort of understand that you don't have to feel bad about doing these things for yourself, and they do make a massive change. For me, my frown line doesn't affect anybody except me, but it truly deeply bothers me that it's there, and that's why I've had Botox done on it, because it really does bother me. Even though everybody else is like, oh, it's fine, but to me it's not. And that's the I guess a point and that you'd hear from a lot of your clients, it's not really about their selfie game. It really is about those little things that actually bother you. Do your crow's feet bother you? Do your frown lines bother you? Have you always had that small lip and you just like that top one to be a little bit more balanced with the bottom one? These are the sort of changes that you're actually able to do when people come and see you.
Yeah, exactly. And it's such a good point to get out there to women that there's no need to feel shame or to feel selfish or whatever word you may have attached to it or someone else has attached to it for you, that if it makes you feel confident, it makes you feel good, then that's all that matters.
Yeah.
And working with clients who then come back and tell me that, they've just by doing a few things and giving them that confidence, they've gone for that job that they've wanted, or changed careers, or they've done something, but they've done it because they've felt so much better about themselves, or they felt like they were frowning for so long, and that was affecting, like I've had people say to me, it was affecting how people perceived them at work. They thought they were an angry person or this really intense person, and then all of a sudden they're like, oh, everyone says I'm really approachable now, all because they were just constantly frowning, just little things like that.
Yep, I understand that. Frown.
Yeah.
That's serious life. That's not really serious. It's just concentrating.
That resting something face.
That's
yeah.
it.
I've literally had a client come in before and said, my colleagues told me I have a resting bee face. Can you fix it?
That's nice colleagues that she has.
Yeah. I was like, do you want to change jobs while you're at it?
So what can women expect? Because I guess that's the other scary thing. Like, obviously it's needles, there isn't any other way that you can get it into the skin, like
yes.
needles. So what do they expect from a procedure?
Yeah. Look, it's every single time, it's always much quicker, less painful, and a lot less traumatic than you ever think it will be. Most clients will work themselves up quite a lot, which actually works in the injector's favour, because then they go, oh, that was actually much better than what I thought.
Yeah.
It's something, say with anti-wrinkle, I have clients who tell me they take the day off for their first anti-wrinkle treatment. Ladies, it's a lunchtime treatment. You can literally come in, walk out, go back to work. You can put your makeup back on. It's absolutely fine. It is so quick and easy. Anti-wrinkle feels like a little sting or a little pinch, only for the couple of seconds while we're doing the injections, and it only takes literally a couple of minutes to, say, even do like your frown, forehead and around your eyes. You're looking at a couple of minutes of injecting, so really, really easy. If people are really quite concerned about the pain factor, I always say let me know, or let your injector know prior, because there's lots of things we can do to help keep you comfortable throughout. We've got squeezy balls, we've got ice, we've got all those sorts of things.
Yeah.
And you can also take some pain relief before you come in if you were quite concerned. But people do always surprise themselves that it's really not as bad as what they think.
Yeah.
With the dermal fillers, they can obviously be a little bit more uncomfortable, mainly not exactly more uncomfortable, I should say, but more just because they take a little bit more time than your anti-wrinkle injections.
Yeah.
But with the dermal fillers, you do have the option of using anaesthetics with it, depending on which areas we're treating in the face. With lips, we always give a numbing cream prior, and we use really strong ones that literally work in a couple of minutes, so we're not having you sit around getting nervous either. We like to sort of get you in and get on with it.
Yeah.
And again, people will really surprise themselves with those dermal fillers. And other areas of the face, people think it will be really painful. And then most of the reports are they just sort of feel like a little bit of a sting. Then the dermal fillers actually have a numbing agent in them, which keeps you comfortable throughout the treatment. And after a couple of injections, they report that they're really not feeling anything.
Yeah. No, I definitely have to agree that they're not, I wouldn't say I have anything against needles, but obviously I don't think anyone particularly likes needles. So I don't think it's worse than having a blood test. If anything, they're much smaller needles, so they hurt a lot less. And the same with filler. Like you said, the area is numbed, so you don't particularly feel it at all. Ice after it. I do recall my sister and I went and had it done together. And she was drooling all over the place. Quite hilarious. I'm not a drooler, but she was a drooler. And it was quite funny. And she's like, did I drool? We're like, yep, you drooled. Feel it. So we were good and numb well into having dinner afterwards. So,
exactly.
It definitely isn't, I don't think, in my opinion and in my experience, it definitely wasn't as bad as what you think it might be.
Exactly. And where I mentioned the time with the anti-wrinkle, I should also mention with the dermal fillers, obviously it takes a little bit longer, but still, even for your lips, you're really only looking at about 10, 15 minutes for the injectable procedure. Same with other areas of the face as well. So it's not this prolonged period of, being jabbed with needles or anything like that.
Yeah. How long do they last?
So with your anti-wrinkle injections, you're looking at it anywhere between 3 to 6 months. And it will depend on your natural metabolism and how quickly you break down the product. But as a general rule, most clients will come for their repeat of anti-wrinkle injections every 3 to 4 months. So you want to repeat just when you start to get that muscle movement back, or you might just be starting to see those fine lines again. That's a good time to come and get that repeat treatment. So you're looking at a few times a year for anti-wrinkle injections. With dermal fillers, depending on which area we're treating and how much we're treating as well, and which product we're putting in the areas. Say with lips, you've got the thinner products will last about 3 to 6 months. Your thicker products will last about 9 to 12. In the rest of the face, we do use thicker products, and they're going to be lasting around the 9 to 12 month mark. Again, depending on your metabolism, depending on medications, things like that, and how quickly you break it down. But they are more longer lasting than most people expect them to be.
Yeah. So what are for people that aren't quite ready for the injections or are too scared of needles, what are some other treatments, I guess, on top of your normal moisturizer and cleanse that you do at home? What are sort of some other treatments that you can be getting to help with age prevention and looking after your skin?
Yeah, absolutely. And skin is so important for people who are doing injectables, as well as those who aren't, or maybe want to do that first, because doing skin treatments can help to stimulate collagen elastin production in the face. So it's going to make your face a lot firmer and plumper. And then if you go and do injectables, you're actually going to get better results and longer lasting results as well, because your skin's going to be much healthier and much plumper. Also, if you're just looking to start with that, who doesn't want fresh, glowing, amazing looking skin? Exactly. There's plenty of treatments that can really help to soften fine lines and really brighten up dull skin, and all of those sorts of things that are going to give you that lovely freshen up, make you feel younger and fresher, and you'll notice your makeup sits better, all those sorts of things. So I'm a really big advocate for the skin side of things as well. And with all of my injectables clients, I'm always having that conversation, what skin treatments are you doing? What products are you using? Those sorts of things, because they really do go hand in hand.
Yeah. So some of those treatments are sort of like your microdermabrasion, things like
that. Yeah. So you've got things, if you're dry and you're just sort of getting started with skin treatments, microdermabrasions, as you mentioned, are really good. Get rid of the dry skin. Then you've got things like chemical peels and LEDs, again, really good for dryness, good for breakouts. They can help with pigmentation as well. LEDs are great for redness and collagen and healing with the skin. Mm-hmm. And then you can move up if you've got concerns for, say, fine lines, or you're wanting age prevention, you want to stimulate that collagen, you may have scarring or large pores, things like that. That's where you can move on to things like your skin needling, your laser-based skin resurfacing type treatments, skin tightening treatments, and they're all your more sort of heavier, more intense things for anti-aging, scarring, things like that.
Yeah, things like that. Vampire facial. I'm keen to have one of those. It looks very interesting.
Yeah.
Is that something that you do in your clinic? Or?
Yeah. Yeah. It looks very intense, but it is amazing for the skin.
Yeah. Can you tell me a little bit about that? I think a lot of women are actually curious as to what the vampire facial is.
Yeah.
So what is a vampire facial?
Look, and it is called, a few different things in different places. Basically, it combines a skin needling treatment. So you've got the micro needling, lots of different places called various things. So basically the little micro needles help to stimulate all the collagen elastin, so good for scarring, pores, pigment, a huge range of things in the face. Mm-hmm. Then what is also applied and basically infused into the skin with the needling is PRP, which is platelet-rich plasma, which actually involves using your own plasma. So this is where we're talking about blood, so some people get a little bit grossed out. And we're actually putting that back into the skin because it's just amazing for stimulating all the collagen elastin in the skin. It's just so good for anti-aging.
Yeah, nice. So you're using your own blood as a skin rejuvenating treatment.
Yes, it sounds really freaky, but it's amazing. And it's really, really good under the eyes.
Perfect.
That's one of my favourite areas to put the plasma.
I think I might have to add that to my list along with my frown line that needs serious treatment really soon. Well, I think that about covers everything today. Thank you so much for going through with us and, helping to break down some of those myths and stereotypes around injectables. And hopefully that helps people to pull back the veil and understand what's really involved and what is out there for them to do and when is a good time for them to do it. So thank you so much for coming on. People can find you over on Instagram at the Fit Injector. And we'll also pop your details over on our website at thehellovaginapodcast.com. So all your contact details will be there, and I'll also pop your clinic details as well. So if anybody is in Sydney and they want to go and see you, we'll have all of the details on there. So thank you so much, Felicity, for being with us today.
Amazing. Thank you so much, Tara. That was so much fun. And I really hope that has helped some women out there to maybe start thinking about and maybe come in and, have that chat about injectables.
Yeah, definitely. All right. Until next time, ladies, have a great day. I hope you've enjoyed another episode of the Hello Vagina podcast. Don't forget to hit that subscribe button so that you never miss out on an episode. And also, we would love to hear your feedback. So please leave us a review so that we know that you're enjoying what we're doing, and also so that others can see how much you enjoyed what was in the podcast. So subscribe, and until next time, stay beautiful.